everyone. Today we will going to discuss about the rabies vaccine. Before discussing about the rabies vaccine, first of all, you should know everyone has. Today we are going to discussing about the novel pre-dose G protein vaccine. Before discussing about the vaccine, as we all know that about rabies, rabies is a very fatal disease and it is preventable if post-exposure prophylactic is appropriate and the timely. So, how rabies is happened? It happened due to the dog's bite. But in the India, there are some cases also reported which happened due to the monkey and the cat bite. Rabies is a global health challenge for um, especially in India. Globally, it's short of 59,000 human deaths annually, and in India it is around the 20,000, which accounts for the 60% of the rabies death in India, Asia, and the 35% globally. How is currently manage the rabies cases? The first is the local wound treatment. This is the first step. First of all, within up to 15 minutes, proper wash with detergent, soap, and iodine, povidone iodine. After that, active immunization like vaccination of the victim and the passive immunization like the immunoglobulin. But it depends on the category of the rabies. So post-exposure prophylactic completely depend on the category of the victim. Category 1, category 2, and the category 3.
Hello, sir. Sorry for disturbing, sir. Please make it in presentation mode.
Yes, sir.
Please make your PPT in presentation mode, sir.
Okay. The current challenge of the post-exposure prophylaxis, the most important and the most the limitation of the post-exposure prophylaxis of the newer older vaccine is the non-compliance. Second one is the current rabies vaccine are the cultured cell cultured vaccine, and next is the inactivated vaccines are greater than 50 years old technology. So it is inconsistent in potency, stability, availability, and the adverse effects. The limitation of the rabies vaccine is the compliance. The categorized as the compliant patient who received the full course of the ARV, that is the scheduled dosage of ARV on the recommended dates. Delayed complaints who completed the scheduled dose of the ARV within 60 days but deviated from the scheduled regime. Dropout under non-compliant who had taken at least one dose of the ARV after the animal bite but not completed all the scheduled dose. Limitation of the 4-dose WHO recommendation, and it is a study observation done by the new Center of the Disease and Control and Prevention and the WHO recommendation. It concluded that the significant proportion of the patient did not develop the adequate antibody level after the 4 dosage of the vaccine. That measured on the 14th and the 14th and the 42 days. 42 days. Here is the study on the three patients, and all patients are the category 3 in category 3, and there is the non-compliant. They live and live against the medical advice after the hospital admission, and ultimately they died after 1 or 2 days. So the reason of the death may be due to the lack of the administration of the rabies immunoglobulin and or poor compliance of the vaccination. This study happened in the occurred in the Safdarjung hospital, in which 360 animals by patient are included, and ultimately found that 53% were non-compliant to the full course of the ARV. According to this study, there is a compliance rate of the intramuscular rabies vaccine was 60%. What are the limitations and the restrictions of the for the compliance to complete the course of the anti-rabies vaccine? There are the interference of the school timing, distance of the hospitals, cost incurred, and the forget dates, along with loss of the wages. The major concerns of the compliance of the complete ARV was the loss of the wages, which around 47%. So why the newer vaccine, the Travis is better as comparison to the WHO recommended 5 dosage vaccine. This novel 3 dose recommended rabies G vaccine is the developed from the virus-like particle technology. The first protein subunit vaccine prepared by the VLP platform technology. First vaccine with 3-dose intramuscular regimen. It is the short duration course as comparison to the previous vaccine, and the better compliance due to the easy to flow regime and the less visits, and the convenience is ready to use. Whereas the previous vaccine is not ready to use, that was in the powder form, and the reconstitution is needed. Discuss about the VLP technology. VLP virus-like particle technology, where the native virus from the native virus D protein is purified and stabilized. Later on, the virus-like particles these virus-like particles are protein complexes exist as the nanoparticles. And VLPs are similar to the native virus particles, but do not contain the viral genome. They cannot replicate but mimic the viral antigenicity without being pathogenic. They are capable of inducing a strong humoral and the cellular responses, and later on developed as the VLPs developed as the vaccines. Clinical study phase 3 for the safety and the immunogenicity of the novel 3-dose recombinant nanoparticle G protein vaccine administered as simulated post-exposure immunization. This is the randomized controlled multi-center phase 3 clinical study. And this study, there are included 800 people, in which they are categorized 2:1 ratio. The triple dose vaccine is double as comparison to the 5-dose vaccine, in which 3 days regime, 533 subjects, and the 5 days regime included the 267 subjects. And found that the efficacy as comparison to the 5-day regime, the efficacy on the day 14 is the 99.24% for the 3-day regime, and the 97.72% for the 5-day regime. And on day 42, in the 3-dose arm, there is the 98.69%, and the 5-dose arm 100%. These differences are not non-significant. So, on the behalf of the safety profile, efficacy profile, the efficacy is same as comparison to the previous regimen recommended by WHO. And in safety profile, the adverse effects in case of the Travis is 9.9%, whereas in case of the WHO recommended 5 doses vaccine, 72.9%. This is a significant difference adverse effect. So adverse effect is more in the 5 dose regimen as compared to the 3 dose regimen. A major adverse effects of the fever.
Recording in progress.
rabies was low. Three rabies free, and for that rabies wins the ET Pharma World Award for the innovation pharma of the year. And also rabies received the award at Golden Globe Tiger Awards in Malaysia.
सर आपकी स्क्रीन नहीं दिख रही है. आपको तो बात से लोग लग रहा है. अभी यार हम कैसा है.
हेलो
मैंने आपको बताया था कुछ डेट डाल देता हूं.
हाँ आप है आगे से. YouTube लाइव
आपका क्वेश्चन के लिए क्या करना है?
लाइव चल रहा है. It watching live. Hello, am I audible? Am I audible? मृत्युंजय जी.
हाँ सिद्धार्थ सर,
Yes, yes, yes. आवाज आ रही है मेरी?
बहुत स्लो आ रही है.
एक सेकंड. अच्छा तो it was a nice interaction, doctor. And there's some questions. Sorry, let me give my introduction. I am myself Siddharth. I'm from the marketing team of the Cadila Pharmaceuticals. And it was a very nice interaction and a very nice, great session by Dr. Abhishek Kumar. And Doctor, while closing, I have some questions in my mind. Like first is what kind of animal bites you have came across with except dog bite? Because dog bites are about 95 to 90%.
आपकी आवाज बहुत कम आ रही है सर.
Hello, hello.
हाँ
सर मैं ये पूछना चाह रहा था आपसे, what kind of dog bites you have came across with apart from animal bites? Hello, am I audible? Hello. 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 Hello, आवाज आ रही सर? हेलो, आवाज आ रही सर?
एक मिनट मैं मोबाइल पे ज्वाइन करवा रहा हूँ फिर सर को।
नहीं, इसमें आवाज आ रही है मेरी?
बहुत स्लो आ रही है सर, इसीलिए मैं इससे ज्वाइन कर रहा हूँ।
आप थोड़ा सा अपना लैपटॉप
एक मिनट वेट कर लीजिए।
क्या क्वेश्चन?
हाँ सर, अगेन आस्क।
Thank you so much, doctor, for your for the interactive session and very informative talk. Just before winding up, I have some questions in my mind, like like what kind of animal bite cases you have came across with, except apart from dog bite, sir?
From dog bite, the cause of the rabies is mainly the monkey and the cat bites,
Yes, sir.
especially in India. Globally, the 97% cause of the rabies is a dog bite. But India, around the some cases are reported for the which rabies is spread through the monkey and monkey and cat.
Okay. So is it, sir, directly from the scratch or the just bite? Like,
No. Actually, it's all depends on the categorization of the rabies for the post-exposure prophylactic. But sometimes the cases category 1 is rarely, because the patient is very aware about the number of the dosage of the previous recommended dosage of the rabies vaccine. There are the
sir.
vaccine. So everyone is scared about the number of prick and the injection due to
Correct.
number of prick and injection. So to avoid, तो category 1 वाले cases बहुत rarely आते हैं हमारे पास. जो number of cases हैं category 2 and category 3 के.
So sir, like मेरा एक सवाल था. If a person is get bitten by a stray dog or a pet dog,
It's very difficult to say, but
vaccination.
the more number cases are the street dogs. A street dog.
Okay. So thank you so much, doctor. That's all from my side. And it was a very nice and very informative session. And last but not the least, we are happy to announce that Travis has won Golden Globe Award and the Indian Pharma Award for its innovation. And it was a very nice interaction with you. And we have about more than 50 plus audiences who are in this live session. And thank you, doctor. Thank you so much, doctor.
Thank you.
Yes sir.
Sir, can we end the session now?
Now, first of all, many thanks to Dr. Abhishek for their valuable speech, which was very presentable, and message is clear that 3-dose rabies is more effective as compared to 5-dose vaccine available in the market. On behalf of Cadila Pharmaceuticals and Travis, I thank you all for taking time out from your busy schedules to be a part of this webinar. Your presence has certainly enhanced and elevated the structure of this meeting. Kindly continue your valuable support for rabies, which is first time 3-dose anti-rabies vaccine. Thank you again.
मैं तो पूरा स्लाइड
आपको तो पूरा picture-
थोड़ा सा तो हेजिटेशन होता है ना, मैं तो इसलिए आया था कि थोड़ा सा
सर
कम करूं।
बहुत अच्छा कमेंट्स आए हैं सर, लाइव कमेंट्स बहुत अच्छा आए हैं
50
सर,
participants.
88 टू से मैं
नहीं, और
लाइव
मुझे
थे।
बोलने जाता था मैं बताता ना।